Good morning to all those who make this broadcast possible, to Gisela, to our sign language interpreter, and above all to everyone tuned in to this briefing. Today, 3,489 people are hospitalized in Cuba. 2,349 are under observation. There are 690 suspected cases and 450 confirmed active cases. Yesterday, we processed 7,107 samples in our various molecular biology laboratories. Of the 7,107 samples processed, 58 tested positive for COVID-19. This brings the total number of samples processed in the entire country since the pandemic began to 777,247, of which 6,479, or 0.83% of people, have tested positive for the virus. As I always mention, samples from all of the country's territories were tested over the past week. The graph on screen shows the percentage of samples tested from each territory from October 15th through October 21st. Next to the pie chart is a table with the exact number of samples processed over that period, according to each of the country's provinces. As you can see, highlighted in red on the pie chart, the highest percentage of samples studied were from Havana, with a total of 27,797 from October 15th to 21st. Next comes Pinar del Rio, representing 11%, or 5,408 samples. Then Sancti Spiritus with 8.8%, or 4,357 samples. Ciego de Avila accounts for 7.1%, or 3,505 samples. Then Matanzas with 1,514, Villa Clara with 1,315, Camagüey 1,255, Santiago de Cuba 1,196, and so on and so forth from all of the country's territories. All of the 58 positive cases diagnosed yesterday are Cubans and the result of local transmission. 57 of the 58 positive cases yesterday are confirmed case contacts. This means that 92.3% of all confirmed cases in Cuba since the pandemic began had contact with someone who had previously been diagnosed with the virus. It has not been possible to determine the source of infection in one case diagnosed yesterday. That said, the source of infection in 26 cases reported over the last 15 days is still being investigated. Yesterday, no one to have tested positive for the virus contracted it abroad. Of the 58 cases diagnosed yesterday, 15 are female, for 47.8% of all diagnosed cases, while 43 were male, representing 52.2% of all cases on the island. 39, or 67.2%, of the 58 cases diagnosed yesterday were asymptomatic at the time of testing. Overall, 61.1% of all positive cases on the island since the pandemic began have shown no symptoms at the time of testing, and this figure rises to 62.6% of cases diagnosed over the last 15 days. By age group, 22 positive cases diagnosed yesterday are under the age of 20. 19 of these are under 18 years of age, for a total of 751 children, or pediatric cases, to have tested positive for the virus in Cuba. Of these, 688, or 91.6%, have recovered from the virus and been discharged from hospital. Those that are still hospitalized are being closely monitored, with no children reported as serious or critical. Meanwhile, 11 people to have tested positive for COVID-19 yesterday are between 20 and 39 years of age. 12 are between 40 and 59, and 13 are over the age of 60. Of the 58 cases diagnosed yesterday, 29 belong to Pinar del Rio, 19 to Artemisa, 7 to Sancti Spiritus, and 3 to Ciego de Ávila. The 11 cases from Pinar del Rio belong to the municipalities of Guane with 17, Pinar del Rio with 4, Consolación del Sur 4, Sandino 2, San Juan y Martínez 1, and 1 case from San Luis. The 19 cases from Artemisa all belong to the municipality of Caimito. The 7 cases diagnosed in Sancti Spiritus belong to the municipalities of Sancti Spiritus with 5 and Cabaiguan with 2. Finally, the 3 cases from Ciego de Ávila all belong to the municipality of the same name. Given yesterday's results by province, Sancti Spiritus has the highest confirmed case rate per 100,000 inhabitants over the last 15 days, with 35.63, after confirming 166 cases. Pinar del Rio has a rate of 33.05 after registering 193 positive cases over the last 15 days. Next comes Ciego de Ávila with 43 cases and a rate of 9.84. Then Havana with 119 cases and a rate of 5.57. A total of 540 cases have been reported in the country over the last 15 days, meaning that Cuba's confirmed case rate per 100,000 inhabitants stands at 4.82 over this period. To summarize, of the 6,479 people who have been diagnosed with the virus thus far in Cuba, 450, or 6.9%, are active hospitalized cases. Of these, 445, or 98.8%, are clinically stable. Yesterday, no one died as a result of the virus, meaning that the COVID-19 death toll on the island stands at 128, with a mortality rate of 1.97%, lower than the global rate of 2.74% and the regional rate of 3.21%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 28 people were discharged from hospital, a negative result when compared with the number of confirmed cases yesterday. 19 people were discharged from hospital in Sancti Spiritus, 4 in Havana, and 5 in Ciego de Ávila. This means that, to date, 5,899 people, or 91% of all confirmed cases in Cuba, have recovered from the virus. Today, 2 patients continue to be in a critical state, while 3 are reported as serious. Now, Lillian, if you could pull up the next graph, which will help us understand how the virus has been behaving in Cuba. The green bars represent the number of cases per month, the red bar the number of COVID-19 related fatalities, and the red line the mortality rate per month. As you can see, there was a high number of cases in April. This started to drop from May through to July, before spiking again in August through to September. And now we're seeing it begin to drop again in October. With the unfortunate death of 6 people this month, October's mortality rate, which speaks to the work of our healthcare professionals and treatment protocols, currently stands at 0.74%, lower than the mortality rate in September, June, July, April, and May, but higher than that of August. This is the COVID-19 situation in Cuba. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 443,041 people were diagnosed with the virus, for a total of 41,299,301 confirmed cases since the start of the pandemic. Yesterday, 6,744 people died of the virus worldwide, for a total of 1,132,500 COVID-19 fatalities and a mortality rate of 2.74%. The region of the Americas, which accounts for 46.58% of all cases worldwide, has reported a total of 19,238,368 cases to date. Meanwhile, 3,136 people died of COVID-19 in the region yesterday, for a death toll in the Americas of 617,762, and a mortality rate of 3.21%. The United States continues to top the list of countries worst affected by the pandemic, with 8,336,282 confirmed cases and over 222,000 COVID-19 fatalities. Then comes India with over 7,706,000 cases and 116,616 deaths. Brazil follows with over 5,298,000 cases and 155,403 fatalities. In fourth place comes Russia with 1,447,335 confirmed cases. From the Americas, after the United States and Brazil, comes Argentina, then Colombia, Peru with over 876,000 cases, Mexico with more than 867,000 cases, and Chile with over 495,000 confirmed cases. This is the information we have on the behavior of the pandemic in Cuba and the world.